Did you know that cervical cancer is the fourth most common cancer in women? A rather daunting fact, but one that we must face head-on to understand and combat this disease effectively. Cervical cancer is, in essence, a case of abnormal cells growing out of control in the lining of the cervix. This part of the female anatomy, the cervix, bridges the gap between the uterus and the vagina. It's a crucial player in the reproductive system, making the threat of cervical cancer all the more concerning. Now, let's explore the villain of our story, the Human Papillomavirus, or HPV as it's commonly known. This is no ordinary virus, mind you. It's a common culprit spread through skin-to-skin contact during sexual activity and is often lurking behind the scenes in nearly all cervical cancer cases. The plot thickens when we consider the sheer diversity of HPV. Picture a rogues gallery of over 100 types of this virus, a dozen of which are considered high risk due to their potential to lead to cancer. It's a silent intruder, often entering and exiting our bodies without showing any signs or symptoms. But as with all good narratives, there's a glimmer of hope. Within the vast landscape of HPV types, most are not permanent residents. Our body's immune system is quite the formidable foe, capable of clearing most HPV types within 1 to 2 years. A key takeaway here is that understanding cervical cancer and its underlying causes can empower us to take the necessary preventive measures. With the help of vaccinations and regular screenings, we can detect and treat this disease early, significantly improving the chances of a successful outcome. Let's remember, we're not just passive observers in this story. We can play an active role in shaping the narrative, both for ourselves and for the women in our lives. After all, knowledge is power. This brings us to the end of our brief journey into understanding cervical cancer. Stay tuned for the next scene where we'll delve into how we can prevent this disease. For now, let's remember that the body's immune system usually clears most HPV types within 1 to 2 years. The good news is that cervical cancer can be curable when detected early, and that's where the importance of prevention comes into play. One of the most effective methods is the HPV vaccine, a powerful shield against the virus causing most cervical cancers. This vaccine, often referred to as the cervical cancer vaccine, can protect against several types of HPV, including the high-risk ones that can lead to cancer. Another significant preventive measure is the regular cervical screening tests. These tests are our first line of defense in detecting cervical cancer in its early stages. The new cervical screening test, more accurate than the previous PAP test, is a game-changer as it specifically looks for HPV, the virus that can lead to cell changes in the cervix. While we're on the topic of prevention, it's crucial to be aware of the signs that could indicate cervical cancer. These symptoms range from menstrual irregularities and unusual vaginal discharge to pain during or after sexual intercourse, excessive fatigue, leg pain or swelling, and lower back pain. If you experience any of these symptoms, it's essential to consult your doctor immediately. In the fight against cervical cancer, knowledge is our best weapon. By understanding the disease, getting vaccinated, and undergoing regular screenings, we can detect it early and significantly increase the chances of successful treatment. Now let's talk about the causes of cervical cancer. As we've previously discussed, the predominant culprit is the human papillomavirus, or HPV, a common virus contracted through sexual activity. It's worth noting that there are over 100 types of HPV, but only about 15 of these are known to cause cervical cancer. So what are the other risk factors? Smoking is a significant contributor, increasing the risk of cervical cancer by damaging the cells that line the cervix. Long-term use of contraceptive pills is another factor to consider, as studies have shown that women who have taken the pill for 5 years or more have a slightly higher risk. A previous diagnosis of cancer, particularly of the female reproductive system, also heightens the risk. Moreover, having many children can increase a woman's risk of developing cervical cancer. This is due to the hormonal and physical changes during pregnancy that may make the cervix more susceptible to HPV infection and cancer growth. Lastly, Exposure to the synthetic estrogen diethylstilbestrol, or DS, used between the 1940s and 70s to prevent miscarriages, can also increase the risk. Now, let's bring some numbers into the picture. Around the globe, cervical cancer is the fourth most common cancer amongst women, with over 604,000 new cases reported in 2020. It's also important to understand that this is a disease that primarily affects women over the age of 35. And here's a staggering fact: HPV causes 90% of cervical cancers. This underscores the crucial role of HPV vaccination and regular screenings in preventing this disease. Remember, knowledge is power, and the more we understand about cervical cancer, the better we can protect ourselves and our loved ones. In conclusion, staying informed, getting vaccinated, and regular screenings are crucial steps in preventing and detecting cervical cancer early. It's vital to share this knowledge with those around us. Let's create a ripple effect, spreading awareness about cervical cancer and its prevention. Thank you for joining us today. Your engagement helps us make a difference. So don't forget to like, share, and subscribe for more informative content. Stay healthy, and remember, together we can empower and protect each other. We'll see you in the next video.